I am joined here by Miriam Martinez. Miriam is the Chief Pharmacist and founder of Roseway Labs. Hi, Miriam.
Hello.
Thank you very much for joining us. So Miriam is going to talk to us about the role of compounding in skincare. She is going to give us kind of overall introduction, talk to us about how compounding can be used, understanding the mechanisms, and also how it can be used to treat skin conditions with a specific focus on acne and anti-aging. So what we'll do, Miriam has a presentation ready. I'm going to pop my camera, I think we're both going to pop our cameras off in a second, and then I will come back on at the end and we'll do a Q&A. So any questions that you have for Miriam, if you can just drop them in the chat box here. We've got someone moderating the questions, and then I will come back on and field them to Miriam at the end. So if you're ready, Miriam, I will hand over to you.
Fantastic.
Right. Okay.
So I hope you can all see my presentation. Well, today we are going to talk about the role of compounding in skincare and how important it is to understand a little bit what compounding is and how can we actually apply into our practices. So what is compounding and how can we actually utilize that to treat the skin conditions? All the insights of compounding, the use of the treating adult acne, and the use in anti-aging. In terms of the compounding, we had a lot of questions like, what is compounding? Well, compounding actually started a long time ago. That's how pharmacists were working before. Before all the manufactured medicines were in the market. So since 1960s, that was actually kind of our main role. And now, because of all the advances in technologies and tests, we realize that there are a lot of variations in between people. So we needed to act and adapt all the medication to all those conditions and there's new variations. Before, compounding was just for those exceptions, let's say, when something wasn't working properly or they needed some different strengths, different vehicles to apply or take the medication. Exactly, and nowadays, because of these variations in compounding, we can offer a better treatment and approach to the progression of the illness. To do that, in order to do that, all the operations and all that happens behind the scenes needs to be under the supervision of a compounding pharmacist. That is, all the compounding pharmacists, they are going to need a strong understanding of the prescription drugs, the potential side effects, interactions, basics like chemical properties of all the compounded items, and that more or less that describes the basics of what we actually do and what compounding should be. Sorry, this just the slides is a little bit confusing in here. I'm not used to that. There are different steps that we need to just carry out just to make sure that actually all our formulations are done correctly for the purpose that is intended. So in terms of the formulation, we need to consider like physical and chemical properties of the desired formulation, the route of administration, the illness that is intended to treat, if the patient has any allergies or incompatibilities. And once everything like that is defined and we have the purpose of the formula, after that, we will need to go into describe all this needed. What equipment do we need? Do we need to purchase a new equipment? Is the ones that you have sufficient just to create that formulation? We need to define the expiry date, which is really important in this case because they are formulations done extemporaneously right there and then. It's not like a process of manufacturing when they put products into a stability test to determine that expiry date. Once that is done, we need to design the packaging. The packaging plays an immense, huge role in terms of the expiry date to protect the active ingredients and to maintain the integrity of the product. So it's efficient throughout the whole expiry date. In regards to sourcing the materials, we need to validate all our suppliers. To validate our suppliers, we need to guarantee that they are as compliant as we are. So it requires a lot of paperwork, I would say. And they need to be compliant not just with the country of origin, but the destination, which is us. So it needs to be compliant with the UK regulations. All the active ingredients as well, they have different properties. Some of them, they might become micronized. That is, small particles will increase the penetration of the active ingredient and the activity and viability. Others, they might need a treatment before using it. Then we will need to maybe reduce the size of the particles that mechanically or chemically before using them. The basis, another thing that actually requires a lot of attention is the basis or vehicles of administration. So you will need to take into account how is the person going to apply or take that medication, how deep into the tissue you want that to penetrate. So just to give you an example, like oil bases with lipophilic active ingredients, that means that they like that kind of fat. If you put them together, the active ingredient will be released the drug slowly, achieving a more localized effect instead of just going into the bloodstream and have that kind of systemic effect. After that, we'll need to determine the pricing. In terms of the pricing, a lot of people think that compounded items will be really pricey items because they are personalized medications, and in kind of a way it is true. But if we compare compounding pharmacies with the special manufacturers, which is the closest body offering this kind of compounding, we are a little bit more reasonable with those prices. So we believe in that kind of approach to everybody, so everybody can have access to this kind of medication. The production, before going into production, certain standard operation procedures need to be in place. If any manuals, training of the personnel, what quality control checks are going to happen throughout the production, and what kind of record keeping you're going to need to actually keep that safe, not just for the patient or formulation, but for the team as well. So you need to carry out like risk analysis also. And once everything is done, trials need to be happen before it reaches the patient. So you make sure that the formulation is correct and it delivers what is supposed to be delivering. So you do the trials, and when you are completely sure that that formulation is being done properly, you will train your personnel and they will deliver that formulation, which at the end another pharmacist will need to contrasign and double check again that that formula is properly made. So we'll process the dispensing. The dispensing is a normal dispensing that will happen in any community pharmacy. where you compare the product prescription and everything is valid, and you just process to do the bagging up and send the medication over to your patients. So one of the most questions, the majority of the questions that we have usually after explaining what we do is like, oh, the quality and safety. That's actually quite an important matter to cover. How we operate, well, now everybody knows what an FFP3 mask is. So those are the ones that we use in the laboratory when we enter. Nobody is allowed to enter in the lab with any kind of PPE. So we use the FFP3 masks. We use the double gloves, lab coats, beer nets, hair nets. So we keep the contamination to the minimum. We never touch any API container without wearing the gloves all the times. When we do our compounding, that happens in a laminar flow cabinet where the air flows in a vertical way, so you protect the sample from the operators, so there is no contamination. We use the different technologies and apparently they're asking me to turn my camera on. Just a second. Yeah, is it on? Can you all see me now? Okay. So one of the things that we try to maintain is the safety of the patient and the operator. And to guarantee that, we have cleaning rotas and cleaning records like in any other company you will have. So you will need to sign and countersign that that's being happened. So it's done by one and checked by other. On top of that, we have a batch documentation. So you will record absolutely everything, really. You will record the API, the batch number of the API. You will contrast that with your certificate of analysis, which will explain exactly what kind of tests they have done on the active ingredient to know that is really what it is. That's just an essay, let's say. Those companies supplying those raw materials, they need to guarantee that they have the certificate of analysis, they're being manufactured under the GMP, and they follow the ISO. So all that documentation actually is provided to us to make sure that everything is correct. So as you can see, it's a kind of a robust process of actually manufacturing those kind of compounding items. We have everything record, even like when it was made, who made it, what time, and what APIs have or active ingredients have they used. So in any case, if there is any recall or there is any problem, we can actually track back absolutely everything, even like when that product, that active ingredient was made in another country. So we can have that ability to contact other manufacturers and providers. And the next slide, well, what are the benefits of compounding? I think after explaining all the variations in between individuals and how the technologies and tests are allowing us to see how important it is for our health, what the benefits is actually more compliance of the patient. The patient will feel more satisfied with the treatments and with the outcomes. You can add more than one active ingredient in that formulation to make it easier for the patient to take or apply that formulation. Is much higher quality in terms of like we know exactly what we put in our formulations, and you don't need to go to, let's say, Pfizer and ask them about absolutely everything. It will take ages for them to come back. So we are more responsive and reliable. We have quick turnarounds. So patients, they don't suffer delays when there is a shortage of anything. And you have the ability and flexibility of adapt your formulations to the needs of your patients. So when they have any allergy or they need to change anything in the formulation, is kind of a quick thing to do. The only limitations that we have is like doctors and clinics cannot stock these items because they are unlicensed products. They are considered like specials. And the expiry date, unless this product is put into a stability test, we cannot guarantee more than 30 days in the expiry date. Okay. In this slide, we are going now into acne and anti-aging, which is a little bit more fun to talk about, I guess. For the treatments of the acne, the existing treatments of the acne at the moment, they are a little bit limited. And why I'm saying that? We have 4 strengths, 2 items, 2 forms, maybe a cream or a capsule. So if you go for an antibiotic, you apply it on a cream, and if you or a capsule, but always more or less in the same strength. The flexibility that we have is like not everybody's going to respond in the same way. So you can increase or decrease that strength at any point. We offer a huge range of active ingredients that we can put into the creams. We always suggest go for topical, not oral. We want to treat the skin on the face. We don't want to treat the skin on the feet. So we have the clindamycin, tretinoin, neomycin, zinc, azelaic acid, corticosteroids. It's just to mention a few, which you can mix and match depending on the type of acne that they have. We know that there are, let's say, limitations of what you can add or not on the compatibility of the ingredients. But one of the things that has been used for a long time is, for example, the spironolactone. When it's taken orally, you need to monitor them really closely. Sorry. When it's applied on the skin and it's directly acting on the acne, not any other parts, the monitoring doesn't need to be that closely. So that's one of the advantages about that. You can add aloe vera, you can add salicylic acid as usual, you can add zinc, and you can add certain products that we all know, but in the right strength and combination. So we all probably familiar with the grades of the acne, how we have a different, like if there is an inflammation, if like there are comedons, if you have scarring, or if you have things. I do believe that not all the acne should be treated the same way. And not because the clindamycin that we have in the market doesn't work, you jump into Roacutan. There are certain things that you can do in the middle. You can increase or decrease the tretinoin. You can put it in a cream or you can put it in a gel. And that will actually make you achieve a better result, a better compliance of the patient. If, for example, let's say that you have a patient, and that's just a little bit of a guidance in terms of what to do. If you have a patient that has acne on the face and on the body, you might want to use the tretinoin, azelaic acid, and neomycin together. If you want to add, if you have any more severe one or more, like let's say less inflammatory acne, you could like just a couple of them or 3 of them, tretinoin and niacinamide, maybe just those 2 together, that will help with those things. I know we are sort of time, I guess, and I need to run through this a little bit quick. Sorry about that. The causes of the anti-aging. Well, we kind of all know what is happening to your skin. It doesn't look as before. You start to see like sagginess, you start to see the loss of elasticity, it's more fragile, it's thin, There is a flattening of the area where the epidermis and the dermis are. And they come kind of together, and that makes it like look a little bit worse. People usually go because of the way they look. They want to change that part, and they might not look at what is happening underneath. But experts like you guys are the ones knowing exactly what to do. Was the trend thing was coming through? It's quite important just to keep the skin as it is, and it acts not just as a physical barrier to protect us, but it acts as a reservoir for the good bacteria to act and live on the skin, fighting the other one, fighting the bad bacteria. We need to keep the moisture. We need to control the body temperature as well with that. It helps us to feel pain. It's really important that. So it's more than just it looks good or it looks bad. What can we do about it? There are a few strategies that you can have just to see how you can help your skin to look a little bit better. So we have very wide range of existing options. The market is fulfilled with creams, with CoQ10, hyaluronic acid, and so on. We could do the same, but we could do it a little bit more effective by increasing maybe the azelaic acid content, or maybe adding something like boswellia. It's a natural anti-inflammatory that does not harmful, and it hardly have any interactions with anything. You can use the hydroquinone and tretinoin just to make it a little bit like renew your cells and see that effect. You can add your CoQ10. You can add your vitamin A, C, E. I'm not going to go into what they do exactly because I think you all know, and it's not new at all. And in one of the lines I mentioned that you could add hormones. Well, apart from compounding Roseway Labs, we also have a really wide, enough knowledge about hormones, how they act, and we do believe that actually because the hormones decreases, that's why you are aging, not the opposite. And when those hormones are, for example, is estradiol and estriol, they keep the production of the collagen, and they keep the moisture of the skin. So that can be done. A lot of people add estrogens in a cream with antioxidants. You can also add a little bit of melatonin, which is a nice anti-aging. Is coming through. There are products that they are quite popular in other countries where compounding is more common, and they are a little bit more adventurous to do that. The only thing that I will say is, like, remember, those products are licensed, and those products, they will need the prescription from a prescriber, because you can make it actually quite potent, and you're gonna need to monitor the patient a little bit closer when you add certain things, just that they're not aggressive to their skin, and you create pigmentation or things like that. So just keep an eye on those kind of things. And well, I think I've been a little bit over my time. But just, Roseway Labs, one of the compounding pharmacies, we offer those kind of products. We can guide you. I hope you enjoyed it. And it's a pity that I couldn't go through every single ingredient just to explain. Thank you.
Brilliant. Thanks, Miriam. That was really interesting. We've got a few questions that I'm going to go through. I know you did speak about kind of specific acne formulations and how that would really have to depend on what it was that you wanted to treat in different clients and what they were kind of presenting with acne. But in terms of kind of turnaround times, what do you usually work with, and for when you kind of start formulating a product until when that can then be kind of sent out for patients to use, or when patients can kind of get their hands on it?
Okay, at the moment, if we are talking about normal formulations that we work with and it's not new, it's just a modification of what we do, it will be, we are talking about 24 to 48 hours to be sent.
Okay, so really quick then. Yeah, okay. And what about in terms of costs as well? Some people are asking for creating, I guess, probably difficult for you to say depending on what it is again, but what kind of cost would someone be looking at for, say, an acne product if it's something fairly kind of basic?
If it's kind of basic, we are talking about maybe, difficult to say. Depends on the ingredients that it contains. But if it's really, really basic, it could be between £20 to £40 for a treatment of, let's say, a month.
Okay.
That would be a month treatment. So.
Okay.
But I mean, the only thing is like when you buy, for example, like let's say a product from Obagi and you buy the whole block. You're talking about hundreds, and I know there are a lot of phases. You can reduce those phases by combining ingredients.
Right, okay. So that's another sort of benefit of maybe looking at this as opposed to perhaps buying in, like a whole range where you have to step up.
Yeah.
Or where you have to use a few products. Okay. Someone has asked if you could talk a little bit about compounded topical treatments for androgenic hair loss. This person said they're really interested in finding out a little bit more about that. So is that something that you can perhaps touch on quickly?
Yeah, a little bit. Yeah. We offer a range of hair tonics and hair foams at the moment for an androgenic hair loss. We use the typical minoxidil, but we also could add hormones and DHT blockers just to prevent that hair loss and elongate the anagen phase of the hair. We have products with latanoprost, vanatoprost, that they are working well in different pathways of the DHT blockers. We also offer dutasteride and finasteride, all topical. We are talking all topical treatments, and we have enhancers to enhance the penetration of those products into the scalp and the follicle as well. Like we add tretinoin or caffeine and the normal products. I don't know if that covers a little bit. I could be talking for ages, but
yeah, no, okay. The same person has just asked as a follow-up, do you deliver products directly to patients if a doctor would send you a prescription, and are there any additional delivery charges for that?
Okay, yeah, we work more with clinics than with patients, so we try to adapt ourselves to their needs. Yeah. If they want us to send the product directly to patient, that's fine. If they want us to send it to the clinic, that's also fine. So we are flexible in that respect. The turnaround, again, it will be just about 48 hours, and we do charge delivery if the product costs less than £45.
Okay, and what would the pricing be for a typical compounded hair loss product? Ballpark maybe, or maybe like a from price or something.
Okay, it can start from £45-50 to £600, 700. Depends on what it contains.
Okay, and let me just see what else we've got coming in. We've just got a few more. So someone's asking, do the products typically only have a 30-day shelf life because they're not stability tested? And is it not feasible to stability test each product?
Well, to do a stability test of each product, it needs to be like one fixed product where you cannot modify the strength at all. So let's say that I do tretinoin 0.1% stability test, that will cover just that product only. And if the cost of the stability test, it could be from £10,000 to £100,000. Depends on what ingredients you want to test, because it will depend of the active ingredients. If you have like 4 active ingredients to test, that will keep increasing and increasing. But it can be done.
Okay. Something else. So someone has asked, so that someone is interested in products for hyperpigmentation. So they're asking where they could get a price and ingredients list from. So is there anywhere they could access that kind of thing from you guys?
Absolutely. If you email us, we will be really happy to share our price list with you and work with the combinations and formulations that they want. So they can just send us an email to I don't know if you have it somewhere, but you can send an email to info@rosewaylabs.com.
Okay.
And one of us pick it up, yeah.
Okay, so yeah, any kind of specific questions like that person about hyperpigmentation, that's probably the best thing to do if there's anything specific. And the person who's interested in hair loss products, I think that would probably be a good idea as well, because there's quite a few specific questions about that, and then you can get some direct information about your needs. Let me just see what else we've got here. So with the stability again, would it then be safe to say that the products would be stable for 30 days?
Yeah, that's what the regulations they advise us to say. There are certain products that they will have even more, they have longer expiry date and others shorter, but the 30 days is what we will cover by the regulatory body. So the General Pharmaceutical Council and the MHRA would be happy to see that actually our products have that expiry date.
Yeah, okay, and which covers lots of kind of all skincare products, really, I guess, the same.
Exactly.
Work. Yeah.
Exactly.
Brilliant. So I've got a question that's coming from Facebook. How do you ensure that the active ingredients are pH compatible when combined in one formulation? And then which delivery system have you found most viable?
Okay, the pH, we work with different companies. We work with experts in compounding from USA, from Canada, from Australia, Germany, and so on. So we are, let's say, we are not inventing the wheel. We are actually trying and doing what is being done before. We just help practitioners to see that. So those kind of pH, they've been established by those companies. Those companies, they help us with the formulations, and they will say, like, my base is pH 7. And when you add the active ingredient, it can go to that pH. When it's a semi-solid compounding, which could be like cream or gels, we don't do it in-house, but when it's a liquid, we have a hair tonic or anything like that, we have a pH meter to actually check those pH, which needs to be completely different.
Okay, so in terms of viability of delivery system,
yeah,
that's kind of dependent, I guess.
The basis that we use, actually, they have in vitro absorption, like in vitro absorption, just to demonstrate how well absorbed those products are and how deep they go into the skin, because you don't want to, depends on what you're doing or what you want to treat, you don't want to go to the epidermis, dermis, and so on. So they have studies, they have in vitro studies. Okay,
great, thank you. Another one from Facebook. So someone's asked, a lot of chemists compound on site in countries like Canada. Why is it not happening here as much, if that's something that you agree with?
Well, it doesn't happen here because they don't know that they can. I think it's one of the main things. The kind of education that the rest of Europe and the rest of the world receives is completely different in compounding. Pharmacists, are, I'm talking just by experience, pharmacists in Spain, they are trained to actually compound and make medication, not just dispense it.
Mm-hmm.
I do feel quite comfortable with that. There are even what is called typified formulations, that they are already there for compounding pharmacists to do that, following like a protocol. Compounding is still happening in UK. It happens every day in hospitals. That is compounding. Hospital pharmacists actually compound extemporaneous preparations in the hospitals, and that is compounding. Specialist manufacturers, they do compounding in the GMP facility.
Okay.
But the concept of actually making the formulation, yeah, you just need to have the right skills and the right studies. I will say, like, if any pharmacists want to go into that, please attend to courses. Please put yourself up to speed. It's not easy. It's not just a matter of putting together and that's it.
So it is happening, just on a much smaller scale than in some other countries where they have that. They're really big on that kind of skill set. Okay. So someone's asking about vitamin C. They're asking how you establish and justify the potency of your vitamin C. They've said some medical grade skincare companies have enhanced delivery systems for vitamin C, which they've patented. So how do you kind of go about that with your own vitamin C?
Okay, with the vitamin C, we actually have a pharmaceutical grade vitamin C, no cosmetic grade. We're using ascorbic acid, which has a high purity. And that vehicle is decided based on that vitamin C, which more or less the same companies, they are actually providing us with the base creams, which deliver the vitamin C in a better way. They are, I don't want to say that out loud, but there are a lot of gimmick in cosmetics. And they sometimes they patent delivery methods, obviously, yes, which is great. They patent something, it's a combination of two ingredients. They put in a made-up name, and they say, well, this is just my own. But that doesn't mean the others are not effective, if not as much.
Yeah.
We do offer liposomal delivery systems. We do offer PLO gels, which they are like transdermally. I mean, we offer really big ranges, and different bases will act in different ways, but we can actually guarantee that delivery system, not just on paper, but we see it on patients.
Brilliant, thank you. And then, so probably this is the last question I think we're going to have time for. Someone again on Facebook is asking about retinoids, and they're asking whether you've considered incorporating third generation retinoids into your formulations. We are
actually looking for that, looking for a really great supplier. We are starting to validate a couple of them. So we will love just to start with those things, yeah.
Brilliant. Okay, well, that's a great answer to wrap up on. Let me just have a quick. Okay, so just one more quick one. I think this is quite important. What courses other than a pharmacy degree would you suggest if someone wanted to train in compounding? Is there anything else that they can do other than a straight pharmacy degree?
Yes, there are a lot of courses, but unfortunately nothing is being offered in the UK yet. So you are going to have to, if you are an English speaker, I will say go to Australia or to America. They are offering amazing courses just to get up to speed. If you are, I don't know, Spanish speaker, just go to Spain. They also offer really nice courses.
Sounds like a good idea to me. Spain, Australia, or America. Okay, fab. That's all we're going to have time for. Thank you, everyone, for the questions. That was really interesting. And thanks, Miriam. That was great. And I think we've got a lot of engagement there. So do you want to just repeat again the email address? And I'll also type it in the chat box just if people do want to get in touch with any specific questions.
Yeah. The email address info, info, rosewaylabs.com.
Okay, perfect. Yeah, so if you've got any more questions that you want to follow up with Miriam, then do just drop an email to that address. Miriam, thank you very much for your time. And thank you everyone for your questions and for watching. We have 2 more sessions today, and then we will be on to tomorrow and Friday for the rest of the virtual week. Hope you're all enjoying it. And yeah, thanks everyone. Bye.
Thank you.